All right, so as Dr. Ransworth said, I'm doing my presentation on Kundalini Yoga for psychiatric disorders. To start, I have nothing to disclose. So just a little overview on yoga in general. So yoga was developed in India over 5,000 years ago as a key part of Ayurvedic medicine and represents one of the oldest medical or health practices to date. It uses several exercises involving controlled breathing, meditation, body posturing, and more. So yoga is derived from the biblical word yoke, which originates from the Sanskrit word jujit. Both translate to join together or unite. So yoga's practice increases awareness of one's physiological and psychological state. Ancient texts define yoga as the final annihilation of all the mental states through progressive stages to attain a steadied mind with particular types of graduated mental states. The ultimate goal is the attainment of particular spiritual mind state, which is a salvation or union with the ultimate reality. Real meta stuff. So yoga was first brought to the US in the late 1800s. It took off in the late 1950s and 1960s during the time when several gurus rose to prominence in the US. So I have attached, perhaps well known is the Bhagwan Rajneesh, if y'all had seen the Netflix documentary, Wild Wild Country. Just below the title, there's Ravi Shankar. So he was made popular by the Beatles as they went on their own journey with yoga. And then below is BKS Iyengar, who brought Iyengar, which is falls under the umbrella of Hatha Yoga. So, and also in this time, we have the guru who brought in Kundalini Yoga. So a lot of these gurus, especially with like Bhagwan Rajneesh, there was a lot of backlash. There was a lot of concern from Americans in general. The yogi that brought Kundalini Yoga, he was met with similar skepticism. So that's why there can kind of be, Kundalini can kind of carry this reputation of seeming a little crazy or out there. So types of yoga include Hatha Yoga, Mantra or Japa Yoga, Surat Shabd Yoga, Kundalini Yoga, and Tantra Yoga. So there are 8 sacred limbs of yoga. The most common are asana, which stand for physical postures, pranayama, which stands for breath work, and dhyana, which is more mantra, but mantra meditation. And then I include the other limbs there, but I will continue on. So in 1970, yoga guru Swami Rama amazed researchers when tests showed he could control his autonomic nervous system functions, including heartbeat, pulse, and skin temperature. This was early evidence that meditation and yoga could diminish sympathetic tone and bring the sympathetic nervous system, back into equilibrium. Research in stress has since showed that physical and mental stress that has continued for prolonged periods may result in overstimulation and potential burnout of the sympathetic nervous system. Research with yoga and the broader field of mind-body medicine has continued and expanded alongside advancements in neuroscience and medicine. So more nuanced understandings of yoga's effects on the body now exist. We've demonstrated measurable reduction in cortisol levels, increased release of brain-derived neurotrophic factor, a relaxation response through increased oxytocin and subsequent stimulation of vagal nerve, increase in hippocampal gray matter volume through mindfulness practice, improvements in various domains of cognitive function, as well as amygdala deactivation with mantra chant. So recent research in psychiatry has been in search of the empirical evidence for the usefulness of yoga therapy as a complementary and even a solitary therapeutic agent in psychiatric treatment. So all the body of research, just as a whole, provides good support for my topic, Kundalini Yoga. So Kundalini Yoga stands for the yoga of awareness. Earliest texts of this practice date back to 1500 BC. It was introduced to the West, I had mentioned him earlier, in 1969 by Yogi Bhajan. He's also the founder of the Health, Happy, Holy Organization Foundation 3HO, which is the primary body, governing body for Kundalini Yoga. So Yogi Bhajan was a bit of a rebel in that Kundalini Yoga was kept for the upper class in India for centuries. And he learned it from a very young age, and he actually went to left India, went to Canada first, and then went to the U.S. and spread Kundalini to everyone. And there was a lot of backlash back in his native land for that. So Kundalini in Sanskrit stands for coiled. And when we speak of Kundalini, the Kundalini energy in us, it means that there is a coil of energy that lays dormant at the base of the spine, and it's stimulated and awakened through the practice of Kundalini Yoga. This energy is drawn upward through each of the 7 chakras, leading to awakened experiences of consciousness. I was so excited that I could get like a GIF in this. It's always hard to find ones. Anyways, so the flow of energy in the body allows individual consciousness to yoke with universal consciousness. And the primary objective of Kundalini Yoga is to awaken the full potential of human awareness in each individual and expand that awareness to its unlimited self. Kundalini Yoga is comprehensive in that it incorporates all 8 of the sacred yogic limbs into its practice. It's dynamic in that the techniques can be combined into a set of procedures in a prescribed sequence known as a Kriya. So this is kind of what Allison had used when she did the curtain Kriya. And kind of how she described it, it was kind of a prescribed way of holding your hands, way you would breathe, the way you would position your body. And these Kriyas can be strung together to form an even larger sequence. So there's an emphasis, as again, we saw with Allison's curtain Kriya, on breathing, asanas, which are mainly seated in Kundalini Yoga, mudras, which are the hand positions, which just depending on how you're holding your fingers, that's how you can kind of direct energy to flow in your body. And each of your fingers and parts of your hand have specific meanings in Kundalini Yoga. And then we have mantras, which are also known as mind waves or ways of projecting currents of energy by use of words. And then we have the bandhas, which stand for locks, which are kind of more of an internal thing that you would visualize, where you're kind of creating these locks from the base of your body and through the middle and to the top to kind of channel energy out, like what we saw in the GIF that I had included. So the movements are often repeated and synchronized with the breath. Just as I've mentioned them being prescribed sequences, they're actually given names. So if you're, say, looking for to create internal balance, there might be one named that. So in one of those studies that's covered for PTSD, they utilize the creating internal balance, renewing your nervous system, and the rest listed there. And just so you know that these Kriyas can be practiced independently. They don't have to be done necessarily the full prescription is listed. And lastly, they're structured. There's a structure to the practice and how the yoga session will go. So typically there'll be a tuning in, a physical preparation or warm up of the body, followed by the Kriya and mantra, then a silent meditation. And then there's a period where we'll do a deep relaxation that's kind of viewed as the integration of all the work that you've just done. And then you'll close with either kirtan, which is a song, or prayer. And this is just an example of another Kriya and how they'll describe it and show the positions and kind of how you'll flow through it. So before I get into the research studies that are available for Kundalini Yoga, I just wanted to point out the limitations first, because it just really struck me. So I honestly thought going into this that there would have been a lot of research. I wasn't sure, I didn't think there'd be much on Kundalini Yoga, but I thought there would be a lot for yoga, but there really isn't. So the limitations of research don't just apply to Kundalini Yoga, but to yoga in general. So the quality of evidence is compromised because of high attrition or dropout rates, small sample sizes, short duration of follow-up, and few randomized controlled studies. There's also, when there is randomization, there's usually a lack of info on that, as well as there isn't a lot of info on adverse reactions. And the details of what therapies that were used is sometimes left out. The studies are often vulnerable to selection bias, and there's varying therapy modules, studying populations, different outcome variables, and the quality is usually not good. So first off, depression and anxiety. For yoga in general, there are several observational studies that have shown improvement in anxiety and depressive symptoms, similar to improvement that's seen with just other physical exercise. Most of the studies conducted have been with individuals of new onset and or mild moderate symptoms and suggest the use of yoga therapy as an adjunct treatment for these disorders. Some forms of yoga have been shown to be better than others in terms of reducing the neurovegetative symptoms of depression. And this can make sense because some forms of yoga are more activating, like Kundalini, versus Yin Yoga, which is more relaxation based. Preliminary clinical research suggests Kundalini Yoga may help with improving symptoms of depression and anxiety. For the studies that there are, the frequency and duration of practices has varied widely, so it's really hard to kind of say to really determine how this effect could be achieved. So for OCD, there's actually not a lot of studies for other forms of yoga for OCD, but there were a decent amount with Kundalini Yoga. One of the striking studies was a small 22-person randomized controlled study that showed Kundalini Yoga to be as effective as relaxation and mindful-based meditation in reducing symptoms of OCD. So Kundalini Yoga was practiced for 2 hours a week for 3 months. And then after 12 months, both groups were joined together, and then it was carried forward for 15 months. So the patients were randomized into 2 groups that were matched according to demographics. There were several scales utilized, including the Y-box. At 3 months, there were significant changes in all of these scales, but the perceived stress scale and the purpose in life test. There was also another clinical case report that showed practicing movement and breathing techniques for Kundalini Yoga for 5 to 6 months may decrease symptoms of OCD and need for medication. So for schizophrenia and psychotic disorders, several studies report reduction in symptoms, but they don't define them specifically. Evidence of yoga therapy as an add-on treatment is limited and weak and no better than other add-ons. Also, adding yoga as an adjunct to other exercises and counseling for schizophrenia does not seem to improve symptoms better than exercise and counseling alone. A meta-analysis of low-quality studies shows that practicing yoga as an adjunct to standard care modestly improves anxiety and stress related. So I term that like the secondary symptoms of schizophrenia or the dysphoria we'll experience as a result of your mental illness compared to the standard care alone. And then there's little evidence for effects of on social function or the positive or negatives or what I say like primary psychotic symptoms. And there were no specific studies with the use of Kundalini Yoga in psychotic disorders. For PTSD, there's a limited amount of studies that have been conducted. There was a somewhat recent study using Kundalini Yoga in PTSD. So a small 80-person randomized controlled study showed statistically significant improvement in PTSD and associated symptoms. There were 29 that ended up completing with 21 in the wait list, which were the control group. Again, there were several scales that were utilized. And in this case, participants were not of an homogeneous trauma group experiencing numerous but different adverse traumas. And this isn't unusual for PTSD studies in general, actually. Results have suggested that Kundalini Yoga treatment intervention may serve as a beneficial adjunctive intervention for PTSD. So Parkinson's disease and other neuropsychiatric conditions, yoga along with general exercise, Tai Chi, neurofeedback, they've shown improvement in quality of life, level of depression, and balance in patients with Parkinson's. There was a small 81-person clinical study that was conducted with patients 55 and older with mild cognitive impairment practicing Kundalini Yoga for 12 weeks with memory enhancement training, which is the gold standard as the control. There were no differences. And just of note, so this was actually the study that did use the Kirtan Kriya that Allison had discussed. So this study at 12 weeks and 24 weeks, both Kundalini Yoga and the memory enhancement training showed significant improvement in memory. However, Kundalini Yoga showed significant improvement in the executive functioning. And then only Kundalini Yoga group showed significant improvement in depressive symptoms and resilience at week 12. So I think this was the kind of study that set off further studies, the ones that Villa Gomez had mentioned at UCLA and UPenn. I had mentioned that the prescription of the Kirtan Kriya is to balance out the brain hemispheres. So, I mean, in a way that would be something we would want to prescribe someone that has dementia. So moving on, there is minimal or no clinical studies or ones of, I should say, significance that for substance use disorders, bipolar disorder, mania, eating disorders, sleep disorders, ADHD, and panic disorder. Of note, there are studies that have been done on attention, like the cognitive domain of attention, but the extrapolation of that to ADHD, we have yet to see any, I guess, promising results. Not that they're not possible, just so far. So as far as adverse reactions and contraindications, there are many that are popularly known in yoga and for Kundalini Yoga, but they're rarely reported or published on in studies. We know that yoga instructors generally are not licensed or credentialed through a formalized or recognized system like doctors or nurses are. But some known physical contraindications for Kundalini Yoga. It's generally safe and well tolerated, caution to be taken like with most other mild to moderate forms of exercise. There have been some rare reports of pneumothorax resulting from aggressive breathing. And there's insufficient reliable evidence about the safety of Kundalini Yoga use in pregnancy, though certain kriyas in Kundalini Yoga will specify to refrain from doing at least certain breathing aspects if one is pregnant or menstruating. As far as mental adverse effects, similar to how when we do an informed consent with someone, how we have to go over the risks and benefits, this is kind of what I would mention that there's been reports of by gurus and experienced practitioners of yoga. So they mention disturbances including depressive anxiety symptoms, agitation, psychosomatic responses, suicidal tendencies, mania induction, and psychotic breakdown. So emotional upheavals with Kundalini Yoga can resemble psychotic breakdown, wherein the person might feel unattached to reality or agitated. So in that scenario, like I would have some concern if someone has a severe form of PTSD or dissociative disorder. It'd just be something to be mindful of. Important to note, there are trauma-sensitive guidelines that can be integrated into the Kundalini Yoga practice or other yoga practices. So future focuses of research, I think differentiating the beneficial effects of yoga from other mind-body practices and Kundalini Yoga from other forms of yoga needs to take place. So which elements of yoga practice influence the reduction of symptoms, and are adverse effects caused by specific components of yoga? So is it the breathing? Is it maybe the mantra? You know, we want to kind of parse that out. And further deepen the understanding of the psycho-neuro-endocrine immune mechanisms of action of yoga. So I just found this study to be really interesting. It's kind of new. So it was titled "The Nasal Dominance and Hallucinations in an Adult Schizophrenic Male." So it was just a case report study that followed this woman for over 1,000 days. She had, I believe, like around 140 episodes of hallucinations. That showed that they occurred during a time where there was left nostril dominance. And so the prescription was to do right nostril breathing so as to activate the left side of the brain to decrease the frequency of hallucinations. Really cool stuff. And then also the consideration to use yoga as a primer for therapy. So, you know, there's a lot of talk, can this be used as an adjunct for therapy or is this a treatment for a psychiatric disorder? But also what we could use it for is reducing stress and arousal levels for someone with PTSD prior to the initiation of an insight-based therapy, which usually requires more emotional awareness, you know, such as EMDR or CPT. So just some considerations. These are just some thoughts I had from while doing this. So what I just noticed in the literature, a lot of it is conducted by people that are ardent followers of Kundalini Yoga. There was even an individual who's part of the Center of Mind Body Medicine, who's done been a part of some research studies. And I found that there was difficulty in admitting certain shortcomings in the research, as in they wanted to maybe spin it a certain way. And I get it, because this practice might mean a lot to you, but we do need to be objective when we're presenting it. There are benefits to it, but we also just need to present the facts as they are. There's also, I think what's important, and I feel like some of these points were kind of highlighted in how Allison presented this curtain kriya. So, and also with what Viagovis had mentioned with like religious undertones. So I think the element of having a discipline or commitment to this practice is also something that produces benefits that might not necessarily be able to be tested unless the study was going on for a long time. But, if you're going to have these people that agree to a research study and you're going to give them these kriyas and meditations and tell them to do them every day or every so often, there has to be that kind of buy-in and that real commitment. And similarly, there's the spiritual component to Kundalini, even more so than all these other yogic practices, where it's a very ancient tradition. These mantras do hold meaning. There's more than just saying Sat Ta Nama when you do it. You are echoing very holy and important words, which, if you understand them and believe in them, the effect could be even more profound than it is just what it's doing at a neurobiological level. Similarly, I mentioned the mystical and energetic aspects of the practice. So just taking another from the open lotus heart meditation, there's the mantra that you called hummy hum bra hum. The actual hum part, the humming part, when you hum, it's supposed to vibrate your fourth chakra, and you can feel it. You can feel it vibrating into your chest. And the word hum also translates to a meaning that also lends itself to heart opening as well. So there's just, again, those deeper levels to this practice, which can make this, the possible changes very large. And then what comes with Kundalini Yoga is a lifestyle and community, because more than just a practice that we drop in, there is a community behind it. There are large events. There's summer solstice and winter solstice where thousands will gather to practice for at least 3 days together. There is the community aspect that comes with this, which also cannot be understated for what kind of effects that can have on our mental state. So in conclusion, Kundalini Yoga and yoga in general is one of the oldest health practices. It's both a physical and spiritual practice with the possibility of a lifestyle component. Neurobiological research shows its therapeutic potential for mental disorders. Although Kundalini Yoga as an add-on therapy for certain mental disorders is apparent, quality evidence derived from robust designs, larger samples, and randomized control trials is required to come to any conclusion on the treatment efficacy for mental illnesses. And further research on specific components of Kundalini Yoga and its adverse effects is needed. And with that, that's usually how we end our sessions, by saying Sat Nam. And I will open the floor up to questions. These are my references.